Welcome to my podcast. Today I'm going to talk about one case of counseling whereby a patient will come to you asking about high blood cholesterol, or if he had any relative or friend who had a history of stroke or transient ischemic attack, and would love to know about his basically lipid level. So basically, after you introduce yourself and double check the patient name and date of birth and address, you will ask the patient, what can I do for you today? So the patient will raise some concern about blood result that he knew about his friend, and he would love to check his blood cholesterol. So you will ask, do you have any problem in the past that you might think that you have high blood cholesterol? Do you have any medical condition that you take for it, medication on the long term? And do you have any family history, for instance, of high blood cholesterol? Because we know there is a certain condition called familial hypercholesterolemia. Also, you'll ask if there is any history of other chronic alignment like diabetes, high blood pressure, heart disease, kidney problem, if taking any medication over the counter, any allergy. So all of that, and then you will ask about the lifestyle, if the patient is a smoker or drink alcohol, and the level of their physical activity as well, and what sort of diet do they take. And then after you have done all of that, you will talk to the patient about cholesterol. So you'll say that basically we have a lipid which we take from external sources, and there is a lipid which produced by the liver. So basically you will tell the patient when there is a high lipid level, patient should refrain from those kind of foods which contain high cholesterol or high lipid level, substituted with a healthy diet measures. And if there is a need for any pills, like for instance statin, there is certain ways whereby this tablet to be taken. Say for instance, if the patient has high blood cholesterol and he's the right candidate for statin, so you will explain that it's a tablet or it's a pill which to be taken with water on the same day, every day, late evening. And we have to do, of course, liver function test before taking statin by 1 month, 3 and 6 months consecutively. And if the patient is a woman, you need to check if the lady is not pregnant, because she can't take it if she's pregnant. It's contraindicated. And then after you explain all of that, you need to draw the patient attention to the side effect, to the well-known side effect, like for instance, it might cause gastric upset, tummy pain, feeling nausea, sick, dizziness, and in certain condition there might be muscle pain and joint pain. Also, you need to tell the patient that when they take statin, they need to avoid taking grapefruit with it, because they both they are interacting. And once all of that has been explained, you need to tell that statin can react unpredictably with other medication. So you need to check what sort of other medication if the patient is taking, in order to draw patient attention to that. Also encourage the patient to increase their level of physical activity, like walking, jogging, and substitute their food with the healthy measures, like for instance decrease red meat and substitute it with fish and white meat like chicken. Also, you need to tell the patient there is another side effect with statin, like for instance, it could lead to, as I say, gastric upset. It could lead, beside the tummy pain, it could cause constipation, diarrhea, flatus, and tell the patient that if he notices anything that doesn't seem right, like for instance, in the long run, it could cause muscle pain. He should go either to the emergency or come back to the GP and notify about that. If the patient is a smoker, for instance, you need to advise about smoking cessation clinic and explain the nicotine replacement product that's available, and give the choice for the patient which one he wishes to go for. And if the patient is a drinker, for instance, you need to draw their attention as well and explain its effect, and try to understand the patient point of view if they are willing to decrease and minimize the level of their drink, and advise that it's advisory not to exceed 14 units per week for both gender. So by that, I should have covered most of the important points in relation to counseling around statin whenever there is high blood cholesterol. Thank you.